Do you want to be beautiful in your teenage years and grow up as a good-looking person without any health problems? Then you should be concerned about some STDs, including hepatitis.
Hepatitis is generally a liver disease and it can cause all sorts of wacky-tacky stuff onto your body. There are 5 different types of hepatitis: A, B, C, and D.
Hepatitis A is most commonly caused by eating or drinking something contaminated with feckled matter. It could also be caused by eating raw shellfish from water polluted with sewage, close contact with someone who's infected, or having sex with someone with the virus. Hepatitis B is caused by the HBV virus. It's passed from person to person through blood, semen, or other bodily fluids. This could be passed on through sexual contact, sharing of needles, accidental needle sticks, or from a mother to child at birth.
Hepatitis C is caused by transmitted blood.
Hepatitis D is caused by being infected by the hepatitis B virus. Hepatitis E is caused by consuming contaminated foods and drinks. If you have this STD, you are going to experience and be inflicted to nausea, vomiting, jaundice, itching skin, and rashes, swelling, low appetite, and urinate dark-colored pee. Crazy, right? You don't want to have that now, do you? Yeah, I don't.
If you don't have it, then you should be aware of needles of any sort, such as injection needles, tattoo needles, and drug needles. Needles may be infected with viruses from previous uses.
So basically, do not share needles with anyone. Don't even share razors, and especially with toothbrushes. You never know if that person to whom you are sharing with might have STDs or HIV. And don't get a tattoo even if you want to have a cool one, like a dragon on your arm, or some face of a celebrity like Johnny Depp. Tattoo needles may have blood from previous clients who might have viruses as well. Tattoo artists may forgot to change and clean the equipment before attaching a tattoo onto you. And that includes with getting a manicure as well.
There are many more ways to get it, such as being born by a mother with STDs or getting a blood transfusion with someone's blood who has STDs. You could also get it from having sex, especially with someone with STDs or an HIV infection. It's also common to get it if you have several sex partners or you just have rough sex, obviously.
If you don't want to get it, then follow these suggestions. Like we said earlier, do not share any personal items such as razors and toothbrushes. And be careful with getting a manicure or a tattoo.
Do not reuse, use syringes or needles of any sort, even for drug uses.
You should always perform good hygiene and wash your hands very often, especially before and after eating or after being in a public place such as the bus.
As long as you are aware of this and perform these tasks to prevent hepatitis inflicting upon you, then you should be okay then.
But if you somehow got it or think you have hepatitis, immediately go and check with your doctor to see if you have it. If you do have it, you should get some rest, be restricted from alcohol, and take medication to help relieve symptoms.
Most people with hepatitis A and E would heal on their own after a couple weeks. Hepatitis B is usually treated with drugs such as imivudine and adavovirine dipivoxil.
Hepatitis C is treated with a combination of peginterferon and ribavirin. Or you should get a liver transplant of hepatitis B or C or D if cause of liver failure.